It's 7 a.m., and at most U.S. hospitals, the beginning of a regular workday. Surgical teams are supposed to be rested and ready to go. But what about when the sun sets? Do patients face an increased risk of complications or even death if they need surgery during the night?
It's important to examine our outcomes when we're talking about very complicated procedures that are very expensive and where the risks and the rewards are really high.
Heart and lung transplants are two of the most complicated procedures and frequently occur at night, taking anywhere from 3 to 8 hours or even longer.
Things done in the middle of the night, particularly something as complicated as heart and lung transplant, should subject patients to a little bit more risk, but that really wasn't the case.
Dr. Ashish Shah from Johns Hopkins Hospital in Baltimore and co-authors studied outcomes of adult patients undergoing heart and lung transplants over the last decade, from 2000 to 2010, using data from the United Network for Organ Sharing, where all information on transplant patients is collected.
Nighttime heart or lung transplants were not associated with increased risk of dying, complications, and even living to a year.
The study appears in this week's JAMA, Journal of the American Medical Association.
Other complications like how long you spend in the hospital, your chance of having kidney failure, was also exactly the same, whether or not you had the operation at night or during the day.
Researchers say these findings were supported across the entire country in all medical centers, regardless of how often they perform these procedures.
The systems that we have in place, the teams that are in place, and the training of all those teams, particularly the surgeons, has been very effective to mediate the risk of a nighttime procedure.
Catherine Dolf, the JAMA Report.